Hi, my name is Krista Bartholomew and I live in the state of Florida. And this discussion board is about informed consent. The informed consent form that I found was from a counseling practice in the state of Maryland. According to the ACA Code of Ethics, A.2, informed consent in the counseling relationship. Counselors explain to clients the nature of all services provided. They inform clients about issues such as purposes, goals, techniques, procedures, limitations, potential risks, benefits of services, the counselor's qualifications and credentials, relevant experience, and approach to counseling. It speaks to the approach of counseling and continuation of services upon death of the counselor. They take steps to ensure that clients understand the implications of the diagnosis and intended use of tests and reports. It also speaks to talking about fees and billing arrangements and procedures for non-payment of fees. Also, the right to confidentiality and to be provided with an explanation of its limits. The informed consent should obtain clear information about their records, to participate in the ongoing counseling plans, and to refuse any services or changes, and to be advised of the consequences of such refusal. In the state of Florida, when I looked up rules and regulations on the informed consent form, it brought me to Florida Statute section 491.009, and it's not really clear. It doesn't go into depth on what needs to be in the informed consent, but it says that Section 491.009 states grounds for denial of a license or disciplinary action, including performing any treatment or prescribing any therapy which, by prevailing standards of the mental health professions in the community, would constitute experimentation on human subjects without first obtaining full and informed and written consent. And under Chapter 491 of the Florida statutes, that is for licensed mental health counselors, licensed clinical social workers, or licensed marriage and family therapists. I also found another section which doesn't really say licensed mental health counselor, but it says community mental health center or clinic, and that whoever provides like public or private mental health agency. But it says, which is more detail, if a patient is a minor, express and informed consent for admission or treatment shall also be requested from the patient's guardian. Before giving express and informed consent, the following information shall be provided and explained in plain English to the patient or to the patient's guardian if the patient is 18 years age or older and has been adjudicated incapacitated. So it says both the patient and the guardian if the patient is a minor, the reason for admission or treatment, the proposed treatment, the purpose of the treatment to be provided, common risks, benefits, and side effects, if the person's on any medication, alternative treatments, their length of care, how it's going to be monitored, and that's pretty much all it says. But that seems more like a mental health facility where where a patient will be staying and not necessarily counseling. So as far as counseling in Florida, it did not give a list of exactly what should be in the informed consent form. But going back to the Maryland informed consent form, the first thing discussed on the form is the counseling process, and it talks about the partnership between the client and the facility. And then it talks about what's expected, and then it talks about what counseling is, and they say is a confidential process designed to help you address your concerns, come to a greater understanding of yourself, and learn effective personal and interpersonal coping strategies. It involves the relationship between you and a trained therapist who has a desire and a willingness to help you accomplish your individual goals. Counseling involves sharing sensitive, personal, and private information that may at times be distressing. During the course of counseling, there may be periods of increased anxiety or confusion, and the outcome of the counseling is often positive. However, the level of satisfaction for any individual is not predictable, and your therapist is available to support you throughout the counseling process. It also speaks to confidentiality, and it talks about how counseling records are destroyed 7 years after your last contact with the counselor. Then it talks about sharing information with other professionals. And if you're under 18, your parents or legal guardians may have access to your records, or if you're in imminent danger or harming yourself, they can disclose information, or if you disclose abuse or neglect of a child, the elderly, or a disabled person. Also, if you disclose sexual misconduct by a therapist, or in any criminal proceedings, in some cases the information can be shared. The next subject in this form is the consultation, where it goes on to say, when appropriate, therapists consult with a psychiatrist regarding any medication concerns discussed on behalf of the client. And then it talks about counseling records and where they're stored and locked and electronically secured. Then counseling decisions, frequency of sessions, number of sessions, goals, type of counseling, any alternative counseling methods that will be discussed or negotiated. And then also speaking of the goals of the counseling sessions. The next part in this form is access to services, where it goes on to say about their normal business hours, and then what call 911 if it's after office hours. Then it goes on to talk about electronic communication, and it gives all that information. And then counseling appointments, that the therapist can be expected to respect you as an individual and to convey this respect by keeping appointments or contacting you if there's a change necessary. And then it speaks to the fees, no shows or late cancellation charges, and the client satisfaction survey, where it says Hopeful Counseling will periodically administer satisfaction questionnaires in the course of your treatment to gain feedback regarding services and areas of improvement. And then the last part says consent. I certify that I have read, understand, and agree to abide by the information, terms, and conditions contained in this informed consent for counseling services form. I have had the opportunity to discuss any questions about the information contained in this form or any other aspect of Hopeful Counseling. I hereby give my consent to Hopeful Counseling to evaluate, provide counseling services, and to refer me to others as needed. And then, of course, the signature of the client, the signature of the therapist or counselor, and the signature of the client's guardian, if applicable, and the date. So the thing that I noticed, it pretty much hit all parts or points on the ACA Code of Ethics, except for speaking to the credentials, experience, or qualifications of the counselor. I didn't see that in there at all. I think all other aspects were talked about, and I thought it was a pretty good form and followed guidelines of the ACA Code of Ethics. And comparing it to Florida statutes, it doesn't really give a suggestion of what should be in the informed consent, so therefore I can't compare or contrast to the Florida rules and regulations on informed consent, because it just says you must have full, informed, and written consent. And that's all. Thank you so much.